At the height of the pandemic, many were worried about the safety of health workers. Those directly involved in the pandemic were then referred to as frontline health workers, and as COVID-19 infections soared, both government and corporate Ghana offered some support to encourage them to work for God and country.
I can't remember, my director can go after 10 p.m. and he leave the facility. I was like, wow, so if my boss is doing this, why not? So the support was there. From the corporate organizations, management support, your own colleagues, we are so happy.
The fear of being infected, losing their lives and not seeing family for months at the peak of the pandemic was something that most frontline health workers had to deal with.
My husband initially, he wasn't too much for it. I talked to him that your wife is a nurse. I want to go out there and make a mark and make a difference. So he thought through what I think I agree with you. That's what you are called to do. Take it and do your best, but please be careful. So I remember those days when I go home, they'll meet me at the door, give me Parazone to dip my shoes in. I'll virtually have to take everything off me into a bowl. Then straight I'll be marched to the bathroom to go and wash before I'll even hug my daughter or my family or anything.
I remember my mom just wants to be sure that the child is also well, and she will just call you to come and give her something that mobile phone or social media cannot handle. So I have to seek permission and run, spend less than 30 minutes and then come back quickly. Initially, my mom didn't want it. She was like, Ga East is not far. I can take a car and come and pick you up and go, because we are looking at what is happening over there. You are not going to be paid dollars or pounds. My friend, come home. It is okay. I was like, and then my sister was like, this is the job she has promised herself, so allow her. And I explained some few things to her that I am safe. So she actually have to accept the fact that by calling her on daily basis for you to hear the voice was enough for her that you are safe. So I don't eat with the COVID people. Don't eat with them. Don't say, where are you sleeping? So we have to make sure that I clear all those misconceptions and everything was in order.
Evelyn and Cecilia, who are nurses at the Ga East Municipal Hospital and the Ghana Infectious Disease Center respectively, they worked tirelessly 24/7 for the first time without seeing their families for months.
I've done 24 hours here over and over and over again. Not because I don't have a home, but for the love of the job, for the people that I know whose lives have been entrusted into mine. I had to go the extra mile, which I did. And thankfully, some of them put through and they went home. So I know it wasn't a wasted sacrifice. It was worth it.
Our bed capacity was 100, but we had patients as far as almost 90 patients, and we had to take on, so we were using most of our wards. And we were running 12 hours instead of the normal 3 shifts. So people can go as far as working for 13 hours, and I only sleep for 2 hours, because the moment I decide to go and sleep, then my boss will call. I hardly sleep because I have to watch and supervise my other colleagues from all the various wards to see if they're adhering to the safety protocol. I reported here in February 2020, and then COVID started on 21st March. So before then, we were coming for training. Okay. So I slept in the apartment from 23rd March, and I went home on the 1st December 2020. That was when I was granted my leave. I had to speak to my family, so we were doing a lot of video calls and WhatsApp calls.
They say their passion to save lives, in addition to their sworn oaths as critical nurses, spurred them on.
I took the bull by the horn. It was my decision. That's my calling. That's my profession. To save the lost, to alleviate pain, promote health, and save lives. So this was the time that I thought, prove yourself. And I'm a critical care nurse. That's my training. I wasn't scared. Maybe I was uncertain because, COVID came when no one knew what it was about, how it's going to be. But for me, I thought it to be one of the challenges that I have to take.
I don't rest when I'm tired. I rest when I'm done. So that has been the thing that inspires me most, to make sure that the best thing is done and my staff is safe. So I always tell them, I'm not interested in your comfort. I'm interested in your safety. So your safety comes first before your comfort. And that is how we're able to be each other's keeper, following protocol. We learn together. We do everything together. And God being so good, we are able to kill this disease down without any of us losing our life. It wasn't easy. Say leadership by example. I remember very well, it is in my diary, when the patient arrived, and I thought my director and my 2 other colleagues would stand behind, but when the patient came, we were pushed in. And when I looked back with my other colleague, Manuel Kessie, the door was closed behind us. So we were like, this is infectious disease, just like TB, HIV we'll be managing. We can do it based on what we have learned and proper infection prevention and control. There's nothing wrong with that. So we just have to speak to ourselves, receive our first patient, and then people were observing.
Evelyn says she was verbally assaulted, slapped, fell, but through it all, she worked her heart out and directed her team on the needed protocols to follow to protect their lives as well.
I wasn't scared one bit, and my people were not scared, because during the training I keep reminding them that if you break the chain of infection, then you'll be infected. If you are not following the appropriate protocol, if somebody is in there and nobody is watching over your other colleague, and when he or she is tired, there will be a breach in protocol. Quality of wear will be compromised. So the best thing for us to do is be each other's keeper. When your friend is going to DOF, the major problem we had from other countries, or let me say facility within Ghana, where most of them got themselves infected, is the fact that when you are going to take off, or what we call dolphin, there's nobody there, there's no mirror. So your other colleague has to serve as a mirror to make sure that even though you know how to go through the procedure, somebody is watching over you to make sure that you DOF appropriately. I taught them, but when I'm going to DOF, somebody is always there to make sure I go through the procedure very well before coming out. Because once I get myself infected, I'm coming to join them, and everybody will be infected. So the fear of people dying, it wasn't there, because we know what we are doing is being tested, and it is in order.
Cecilia, who is the principal nursing officer at the ICU at the Ghana Infectious Disease Center, GIDC, is a critical health nurse and tells me she was at a point overwhelmed but had to follow through with the protocols to protect her life and that of the client.
We've experienced the good, the not too good, the bad, and sometimes the tears even flow. But I think all in all, it's been a wonderful experience. From January, February, March, and part of April, we really had a lot on our hands, because that was the peak periods of the COVID. People were coming in every now and then, coupled with the cases at the HDU, where we usually manage the severely ill patient. It was really a load. I mean, every now and then, the ambulances will be bringing in patients from all over the country, not only Accra. Once there was that need, they will refer, and we have to treat. So it's been lots of work, but I think it's been lots of sacrifice too on our part for us to give back to our country. So all in all, it's been a great experience, because the team here were not here at all. This was a new center. So people were put from all angles, critical care nurses, anesthesiologists, from different areas. So we all have to converge and put in together our expertise to manage the people who came into our hands, so that together we can ensure that healthy workforce that we have in Ghana.
For these frontline health workers, their joy was always to see the patients walk home after several weeks of treatment.
For me, when I see my patient going home, fully recovered, and then they will tell you, God bless you. Because when you receive some of them, especially those with comorbidities, and they are on oxygen, the fear is, hey, am I going to record mortality? Somebody is going to die. I hate mortalities, especially when I am around involved. I think it is something that can be done, you see. And I felt like I haven't contributed my quota very well, and that has led to the patient death. But once you see them going and they are happy, carrying your name of the facility and praising the staff, it is the best. And the second is the fact that you call people to support, and within less than 48 hours, you get a lot of support, and majority is my management support.
and looking at the progression of the COVID disease. Sometimes there are points that we exhaust medical and technical knowledge. Yes, there are times that you can barely do anything. So at that point, we have to help whoever it is to that peaceful end that we can. But thankfully, we have really chopped some successes, because there were times that, the state that the patient came in, you would think, no, this one is gone. But thankfully, we were able to bring on board the expertise, like I always say, and together we saw our patient go home. Some stayed as long as 3 months, progressing from critically ill states, but they gradually recuperated. They became severe. They were transferred out of the ICU into the HDU. Then before we knew, they were saying bye-bye to us. So, that was very fulfilling and quite satisfying.
Though many people still doubt the existence of COVID-19, these frontline health workers say the disease is not and was never a hoax. It is real.
COVID is real, and COVID is out there. If we throw caution to the wind, I'm afraid what has happened to some people that landed them in real big trouble could happen to anybody. This is not the time to play political, play stubborn, or think, hey, there's nothing like that. No. COVID is real. Please, let's keep on wearing our face masks, observing our social distancing, use of the hand sanitizers. Let's wash our hands. Let's eat well. Let's rest well. We can't throw caution to the wind, because you will never know who COVID will decide to take away and who it will decide to spare. So please, let's be on our guard.
COVID is real. I must say that we've lost a lot of lives, and when we did post-mortem, it is there. So it is not a matter of we are joking with it. It's not true. We brought in vaccine, and look at the way we are happy. I remember quite well when somebody said people are on oxygen and they are dying, and I'm exercising with my patient, physio here and there. If indeed it is COVID, why are they walking around? I'm with them, exercising here and there. And I just laughed. Because must we wait for us to get to that stage? No. So if somebody is on oxygen and you realize that people are dying and somebody is very strong, then it means that there is hope. COVID is real. It is not something we are joking. Nobody feels comfortable wearing the face mask, but we need to protect ourselves. So wherever we find ourselves, be in the church or social gathering, we shouldn't even try to take off the mask. There's a third way. People are saying it is in some of the African countries, but the issue is, are we going to allow it to come before? So it is a matter of protecting ourselves, even though to those who believe that it is not there, please, it is real. If you visit the treatment center, especially the emergency ward and ICU, you know it exists. So we beg them to adhere to the safety protocols, and together we can win this battle.
Ghana's active case count for COVID-19 as at 16th June 2021 stood at 1,242, with 9 critical cases, 14 severe and 797 deaths. The simple message from these gallant heroines is for all to continue to adhere to the safety protocols as the country awaits the distribution of vaccines for all to achieve herd immunity later in the year. For GBC News, Mavis Ofe Champon reporting.